Welcome to the GoOutLiving Attitude, a cancer survivor's journey through health and wellness, helping others search for the tools to bring us a healthier and happier lifestyle. Hi, everyone. Jonathan Brandt, GoOutLiving. Today's special guest is Dr. James Lewinsky. He is a doctor of acupuncture and Chinese medicine. Really a pleasure to have you here.
Thanks so much for having me on the show, Jonathan. I really appreciate it.
Yeah, we were talking earlier, and I love the way you look at the holistic aspect of medicine, but I wanted to get started with kind of how you went from the tech industry into medicine, and I thought that was pretty interesting itself.
Yeah, I think it's an unusual way to go. I know my wife is in the same uh, career, same field. We met in school, in acupuncture school, and she knew that she wanted to be an acupuncturist for a long time before she went to school. And for me, I was in the tech industry, and um, at the time I had that was like one of my jobs, and I had a whole bunch of part-time jobs, and I just worked too much, and I started having a lot of symptoms of burnout and kind of getting sick. And I was in my late 20s, so I felt like, man, I'm too young to be feeling like this. And um, we can get into that some more. I've gone over it in some other podcasts, but long story short, I just was searching for answers to my kind of small health challenges, and I ended up in an acupuncturist's office. And the acupuncture and the Chinese herbs were super helpful for me. And I had kind of already been toying with the idea of going back to school. I had been considering studying psychology, or even, maybe trying to get into med school to be an MD. And, the acupuncture and Chinese medicine and the herbal medicine really just, all my symptoms got better. And I liked that I didn't have to talk about it. That was something I really liked about going to therapy. But I also liked, like, sometimes it was cool to be able to go in and the acupuncturist would feel my pulse and look at my tongue and put the pins in, and then I got to basically take a nap. And I just felt so much lighter afterwards, and the stress relief and the it made a big difference for me. So I had to do pre-med courses because I was a social sciences kid when I was an undergrad. So I said, well, you know what? I guess I'll look into it. And the acupuncture school that was closest to me had a pre-med program. And I said, well, great. I can do their pre-med program and try some classes. And if I don't like it, I can, transfer to be a naturopath, or maybe even look at med school or PT or whatever. And, I met my future wife on the first day of class, and just like the classes I had the first semester kind of got me hooked, and I kept going, and I was pretty committed to it after the first semester. But basically, it was more like I knew I wanted to get into a helping field, and fate brought me to acupuncture school.
Well, did you feel like it was to help yourself as well?
Oh,
I mean,
100%. Oh, yeah. I mean, I mentioned that I was a social sciences guy as an undergraduate, and I studied economics and liberal arts and anthropology and history. And I've always been just super interested in the human condition, and um you know where we came from, and our ancestors, and our culture, and why we are the way we are, and why I am the way I am. And I grew up in Vermont, and my folks, we moved up there when I was a kid, and it was kind of a homesteady. We grew a lot of our own food and stuff like that. So I was always interested in, going out and finding edible plants and making our own medicine and that kind of stuff, even when I was a kid. And so in a lot of ways, it was a natural transition for me. And wanting to understand myself and how my body works and how my organism works, and have tools to help myself and my family and my friends. And mm, so acupuncture, part of the reason I chose it was because we're called acupuncturists, but we actually, in school, you have the option to learn a lot of tools to help people besides just acupuncture, nutrition and herbal medicine and functional medicine and supplements. And I got a massage certificate while I was in school. So cupping, there's all kinds of stuff.
Yeah, it never ends, does it?
No, and that's part of why I chose it.
Well, I've always thought it's continuously learning, and whether it's in the medical field or whatever, if you stop learning, that's when usually you have the issues. Um,
100%.
so when we look at health and wellness and Western medicine, we know things aren't going well at the moment. What is your take from the holistic side? What do you see? What are your patients coming to you with?
Yeah, I mean, I think that the main thing, one of the main things I learned in school and in my practice is in Chinese medicine, it comes out of Taoism and just seeking balance, the middle way, finding the the sweet spot between extremes. And I think part of the problem with our medical system is it's just gone so far in one direction that you know the system has lost sight of some of the things that are really important for individuals and patient care. And I think that doctors are amazing. I think our modern medicine's amazing, and doctors and nurses and all the professionals who work in hospitals have a tough job. So there's a lot of I think a lot of people struggle with burnout, and it's not just in medicine. It's a just a common problem in our culture and in our country right now. People are super stressed and burnt out and disconnected from themselves and meaning, and disconnected from each other. So um I think that that's a big part of the problem. The problems in our medical system are similar to the problems that we have across our culture. um and One of the things I like about my training and my practice, I learned to think about sort of dualism and holding different things in mind at the same time. Our brought up in the American school system with multiple choice tests and write a paper. I was always, my brain was very much trained to find the right answer. And what I've have found in my professional education and in practice is that sometimes two things can be true at the same time. Maybe one thing is more true in a certain way and something else is true in another way. But we were talking a little bit about resolution, and I come from a tech background. So Chinese medicine, it's an old system. The diagnosis system is based on the natural world. So it tries to look at the human body, the human organism as an environment. And the goal of treatment is to bring the environment back into a healthy place and help the organism become healthy again by improving function. Functional medicine in some ways comes out of traditional systems like traditional Chinese medicine and Ayurveda. But I think that there's a nice complement there with um, Western biomedicine, because Western biomedicine tends to be very high resolution, reductionist, sort of zooming in and trying to find, problems with individual areas of the body and individual systems and stuff like that. And I'm generalizing, of course, it's not like this for all practitioners, but I see Western medicine as generally being, biomedicine is very high resolution. It gets a lot of detail, and the models that we use in Western medicine are often sort of mechanistic, looking at the body like a machine, the brain's like a computer, the body's like a car where we can swap out parts and things like that. And problems tend to be contained to individual systems. And a lot of that thinking is comes out of, at least my understanding is, a lot of that thinking comes out of dissection, especially in physical medicine, because dissection, you're cutting the body into pieces and you're working with a dead body. And in some ways it's obviously it's amazing and it's important, but it's also that's not how the body works in a living organism. The our brains don't differentiate between bones and muscle and um, connective tissue. It all just kind of flows into sensation. So Chinese medicine that I learned it and the way I practice, it's more a lower resolution. So we have less detail, but we're looking at the body and trying to find quickly where it's out of balance, and so that we can get into treatment faster. And the treatments, in some ways it's simpler. Okay, there's too much heat in the body, and heat kind of generally corresponds to inflammation. There's too much heat in the body, so we need to clear heat. How do we clear heat? Well, we can give people these herbs that are cooling. It's in some ways it sounds very simplistic, right? But it's not so much that the thinking is, oh, the herbs are cold. The herbs have a cooling effect on the body. They're anti-inflammatory. And I think a lot of people get lost in the language, but we're describing the same physiological processes, just with a simple naturalistic language and naturalistic model. So I think I'm veering off track a little bit here. But
No, not at all. I mean, what that kind of says to me too is, well, what you said was you were dealing with the body, where Western medicine, like you said, it's getting down to, well, that's why we have specialties. They look at the one specialty. For me, it was oncology, and they don't really look outside of that. They're there to treat that one thing. And that doesn't necessarily help you in the long run because, well, with me, I ended up with gut issues, for instance. My wife ended up with all kinds of side effects. So they're not looking at the whole because they're just concentrating on the one.
Mhm.
Where you're kind of more, you're looking at the entire body. Well, even from the functional health standpoint, that's really, you're looking for the root cause of things as well.
For sure. Yeah, for sure. We are trying to get at the root cause of things. I expect that Western medicine eventually will go down a similar path where, you get to a place, and I think really skilled practitioners are always doing this anyway. You're trying to keep the big picture in mind while you're also treating the specific, big glaring problem at the same time. And what we call that in school is root and branch treatment. So root cause medicine. You're looking for the root cause of the problem, but then you also want to treat the branch, which is like the in your face issue that is screaming at the person who has the problem, screaming at you. And it's the main thing, that the bleeding neck problem is what they call it sometimes, right? So sometimes that's the same thing. Like in an emergency situation, if I don't know, if somebody got cut or something like that, then that's the big problem that you got to fix. That's the root and the branch. And branches can also become roots in other ways. Like, for instance, in your situation, you have, gut issues now. Originally, the gut issues were caused by something, caused by a medication or caused by a treatment or caused by the disease that you had or some combination. And then what happens is it becomes its own self perpetuating problem. Now it's a new root. So, that's where it gets tricky, because, you have to kind of figure out how to approach things. And Chinese medicine, functional medicine has a really good approach, which is basically like, okay, we got all these problems. Is this person sleeping okay? How's their digestive system working? How are those like main engines working, and or those main processes, and can we get those working better, and then see what shakes out and see how the body does to heal itself.
Well, and I assume nutrition comes into that as well. What are we doing to ourselves in the first place?
Yeah, 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 exactly. Yeah, so that's a big part of the puzzle for a lot of people. And most of us who go down a health journey, it's a big part of it is diving in. I know that that's a big part of where I started when I was in my early 20s, long before I thought about going back to school, was just looking at nutrition and experimenting and trying to figure that out. At least for me, being a bit of a perfectionist, of course, it came from a place of wanting to do it right, like figure out what's the right thing. And um, what I encourage my patients, and where I've ended up, is basically to approach things with an attitude of curiosity and openness as much as possible. Like, see it as try to make it into a fun experiment, and just make really small changes. and see what happens. Don't, a lot of times um, the body likes routine and it tries to keep itself in balance. So a lot of people that have heard of the term homeostasis, and the generally accepted, definition of that word is balance, like the body's in balance. But that also means that the body resists change. Homeostasis is the process of resisting change in the body. So a lot of times where we see things like somebody starts a new, workout routine, for instance, and they last maybe 3 weeks or 6 weeks and then kind of, go back to the way they were before. That's the process of the body resisting change. And, maybe they were trying to do too much too fast or something like that. And so smaller changes, try to keep it fun and interesting. Yeah.
Well, and you have to give it time. It's the body doesn't react like overnight. It needs
Mhm.
that time to figure it out.
Yes. 100%.
So, with the fast pace of today's world, with everybody sitting in their jobs, typing, doing, this stuff,
Yeah.
not a lot of physical fitness happening. Uh, Are those the type of patients you're kind of seeing right now that, okay, kind of dove straight into, hey, let's make money, let's do all this, and kind of forgot uh, to take care of themselves, really?
Yeah. I see a lot of patients like that. I see a lot of patients with chronic illness too, who, um, haven't found the right person who can help them. So, but yeah, I see a lot of patients like that. Acupuncture is, and Chinese herbs as well, and are really helpful for a lot of the tools that I have to offer are helpful for people who, um, are burnt out and stressed out. And, I think over time, that stress and burnout often turns into chronic physical problems, migraines, headaches, neck pain, back pain, stomach problems, IBS, ulcers, indigestion, chronic constipation, things like that. Um, just a general feeling of malaise and like something's not right. Trouble sleeping. A lot of people have trouble sleeping because it's so much screen time, not enough time outside, not enough exercise, not enough time with their friends, not enough downtime. Um, so, but I don't. Acupuncture is really great for those things. You know, y- Basically, you get an hour to go see somebody, and most of the time at your treatment is you're on the treatment table, the lights are turned off, and you're just there by yourself to relax. And we call it the acu nap. And because basically, I know that I'm doing a good job when I'm at work if I walk down the hallway and there are snores coming out of most of the rooms. Um,
Right.
and for a lot of people, for whatever they come in, I almost always put in some points to help with stress. And it's one of the acupuncture's strengths. It helps to calm down the sympathetic nervous system, the like fight or flight, just chronic stress response. And I can't tell you how many times I've had people come in with digestive complaints, and I just start putting pins in, maybe the first couple pins, and suddenly the person's stomach starts gurgling. And, that's a sign to me that, oh, okay, things are calming down, the body's feeling safe, and the digestive processes are starting up because, that's what happens when you're not under a whole bunch of stress. Stress shuts those things down. So acupuncture, uh, a lot of people say, well, how does it work? And, why does it supposedly work for so many things? And a lot of the things that it helps with are the symptoms of chronic stress, all those conditions that I listed. So because it helps to regulate the body's stress response, regulate the autonomic nervous system, it's effective for those kinds of things. And like you said, it does take time. So there's a bit of an entrainment process where a person comes in for a treatment. We regulate their nervous system. The body is calmed down, and it's in a better place for a few days, and then it goes back to the way it's been. That's what feels normal, both to you as a you're living in your body and to your body. So, we tend to stay with the habits and stay with the food and stay with the things, postures, movements that we're used to. Um, so, usually, take headaches, for instance. Usually people see a lot of relief really quickly. And, within 6 to 10 weeks, 8 weeks, something like that, a month and a half, 2 months, most of the time the headaches are way better and we're ready to um, kind of transition to maintenance. And maintenance for people who have chronic headaches, it might be that they come in once a month or every couple of months or something like that, get a tune up.
You brought up habits. Is this part of changing habits, changing behavior? Is you utilize acupuncture,
Hmm.
but I'm guessing that moves into a lot of different areas as well
Yeah.
to help change what is causing those issues.
Yeah. 100%. That's a big part of what I do. And you can probably tell I'm really interested in this. So, when I'm doing a session with somebody, um, and I work with people remotely like this too, and obviously you can't do acupuncture. We haven't figured that out with the with the computers yet. I can't reach to the screen just yet. So, I might show somebody some acupressure points. Basically, you can use your fingers on the points to treat them yourself, and then maybe we'll do some meditation or there's other tools that we can use to um, have a similar effect. And maybe you do them more frequently because it's not as powerful an effect as acupuncture. But if you can self treat the points by pressing on them every day versus getting acupuncture once a week, that can be pretty similar. Um, but yeah, a lot of what happens is working on changing habits that are uh, counterproductive to where you want to go. you know and a lot of people have a lot of ambivalence about change, and that word ambivalence, you want to do it, part of you wants to do it, but part of you doesn't want to do it. And that's one of the interesting things about human beings. We're kind of complicated, which is also interesting, right? And a lot of times, I've talked to so many people who are unhappy with their jobs, right? And it's like,
Yeah.
maybe you should change jobs, but that's easier said than done, right? There's a lot of difficulty involved in finding a new job. And even though we don't like it, it's also a place where we're comfortable sometimes. And, um, you know, so things like that, yeah, it takes time. And oftentimes the acupuncture can be helpful in bringing things up. But then I also recommend journaling. There's a lot of great journaling exercises. Sometimes it can just be you just open a book up and set a timer and write for 10 or 15 minutes and things will just come up. Meditation is good for some people. Prayer is good for some people. Those kind of contemplative processes. And, our culture tends to be, most of the time we're busy doing, we're busy working on something. When we're not at work, we got our, we got to make dinner, we got to clean the house, we got stuff to do with our friends. So generally, we're quite busy just going from activity to activity. And so most people benefit from just a little bit more time to be able to check in inside. And a lot of times the answers are in there and we just have to go looking for them and help them come out. So that's a lot of the work that I do with people. They don't always know that I'm doing that work, but
Well, no, but that's where the relaxation really, somebody starts to relax and they kind of just let it flow, don't they?
yeah, absolutely. And I try to ask a lot of questions, especially if somebody comes to me and, I know that they want to make a change and they need help. The best way to help oftentimes is to ask questions, and they don't even have to be leading exactly. You just ask questions and give people space for it to come up. I'm talking a lot because we're doing an interview, but generally like during a session, I try to, um, ask a lot of questions frequently. Sometimes people ask me and I spin off, but anyway,
A
yeah,
lot of people,
relaxation helps.
yeah, and a lot of people know their own answers. They just kind of need that little push to get it out there.
It can be hard to articulate sometimes too. It's in there, but you can't quite put it into words yet. And it depends on one of the best models that I've come across for understanding a person. It's this old model that it sees us as almost like three different organisms all jammed together. We're like our body is kind of like a worm. It's very reactive. It doesn't like cold. It likes warmth. It likes sweet things. It's very reflexive and reactive. And then we have like a sheep or a dog, like we have this emotional part, just pure emotion. And then we have this intellectual part, right? And we think of ourselves generally as the intellectual part, the thinking part, but really the thinking part is along for the ride most of the time. It's the reaction part or the emotional part a lot of times. So, um, in order for us to really be healthy, we got to take care of our physical body and give it the things that it needs to be strong and healthy. We got to take care of the emotional part, that little puppy dog that needs to go for walks and needs to play and needs time with its friends and needs to just be cared for. And oftentimes we're really harsh on ourselves um, when that emotional part is having a hard time because it's overwhelming, right? And the intellectual part doesn't know what the heck is going on half the time, and it thinks it's in charge, and it thinks it's the only thing there running the show. But a lot of the times, the intellectual part is just kind of rationalizing after the fact. So, when I learned that model, I said, "Wow, that makes a lot of sense," and that's helped me a lot to understand. Like, okay, I gotta take care of my body every day. I gotta eat good food. I got to get some exercise. I kind of know what the bare minimum is at this point. There are things I got to do, because sometimes I don't know. I have little kids, so
Yeah. Oh, I get it. Yep.
I know
Yep.
um, and then intellectually we need stimulation and so and then we want to be useful to other people. So
Again, it's the holistic point of view. It's looking at the entirety. A little bit, well, different way of going here. How do you work well with other doctors? Like if somebody is going through heart condition or whatever disease they're going through and you find yourself with them, do you work well with the other doctors to kind of find what will help that patient the most?
yeah, 100%. I mean, I work at a group practice with it's all kind of alternative medicine. So we have a naturopath, we have other acupuncturists and a massage therapist. um, we all coordinate and share patients frequently and try to help each other. I work with the VA, and I get referrals from them regularly. I don't always communicate directly with the doctors who make the referrals, but I get their notes and you know send notes back. And I have a patient who is on hospice right now, and I've been working with her doctor, the hospice doctor, just to try to we're just trying to help make her more comfortable. Um, and in some ways, she's more open to some of the things that I'm trying to do because her primary concern is um, the patient's comfort. And it's tough sometimes with end of life because eh, the symptoms can be very um, difficult to manage. So but for that particular patient, she has a lung condition and she's got a lot of she's got phlegm in her lungs, and so we're just trying different approaches to try to manage some of that extra phlegm and make it so she can breathe a little bit easier. So the doctor, the prednisone kind of is too much for the patient at this point. So we talked, and I've got her on an herbal formula that seems to be helping a little bit. and it's not interacting with the other meds that the patient's on. So the patient's happy because she feels a little better. The doctor seems happy because, I didn't upset the apple cart. I mean, I don't work. Some of my colleagues work in hospitals. The VA actually has acupuncturists in house. I don't know if all of the VA medical centers do, but the local one in Rhode Island does. And I have some colleagues who I went to school with out in California who work at like Kaiser Permanente. I think they have acupuncturists on staff. So I think that kind of a job, that kind of environment gives a practitioner a lot more opportunity to work in close coordination with other doctors like that. For me, it's mostly I get referrals from other doctors, and I'll send notes back to let them know how their patients are doing, that sort of thing. Mostly.
Do you feel like they're opening up to alternative medicine a little bit more?
Yeah, I've noticed that that's the case in general. I mean, I think the main issues for us, specifically for acupuncture and Chinese medicine, um, there's some of it's our own fault, to be perfectly honest. Acupuncturists are we're an independent bunch, so in general, I found as a profession, most acupuncturists, we just want to be left alone to treat our patients. Just leave us alone to do our thing, and we can't be bothered to get together to advocate for ourselves or anything like that. Oh no. Most of us, most acupuncturists, I think, are part-time, have families like me. Um, and there are a lot fewer of us than like physical therapists. Physical therapists, tip my hat to them because they're very organized. They do a great job advocating for themselves and expanding their scope of practice. And I think acupuncturists also, it's been marketed in this country as energy medicine, and it is energy medicine to a certain extent. Every kind of medicine is energy medicine in my estimation. But it also is very much a body work, like chiropractic or massage therapy or physical therapy. And the Western mind has an easier time understanding that. So, most people, when they hear about liver wind or kidney qi deficiency or heat in the upper jiao, people are saying, what the heck is that? These people are crazy. They're backwards. It's unscientific. But it's more like a game of telephone. These terms and the terminology and the diagnostic system, and it comes out of Chinese culture and Taoism and a naturalistic agricultural society from a few thousand years ago. And over time, it's been kept alive and updated, and things have been added to it. But the basic terminology has kind of stayed the same. And so I think that that's starting to change. And we as acupuncturists are getting better at explaining to people. There's more and more compelling scientific evidence that it works, it's safe, it's good for a lot of conditions. At this point, I learned in my doctoral program that there are more studies supporting the efficacy of acupuncture than physical therapy. And I think most people would find that surprising. I think some of it's just because, for most of us, we're like, oh, sure, some people's backs hurt because their back's not strong enough. So exercising, it's going to help. But
Right.
what are these little tiny needles going to do? Come on, that's not going to do anything. Well, the little tiny needles help improve blood flow, helps relax the muscles, helps the person process and integrate and release the stress that causes the tight muscles in their back, from their frustrating, stressful job. So yeah, some of it's just we understand it better and we're better able to talk to people. I think a lot of doctors, younger doctors, there are a lot more programs in medical school now for younger doctors to learn nutrition and go out in the community and experience things like acupuncture treatments or chiropractic adjustments. So they tend to be a lot more open to it and, interested in working with us. So I would say in general, yeah.
Well, and I feel like, people are kind of fed up with medicine right now.
Yeah.
And they're finding that, I mean, for me, again, my wife, we were on medications, but then the side effects and,
Yeah.
where we can look at, like you said, 2000 years of this has been around
Yeah.
and there's really no side effects. Yeah, maybe we haven't had, they haven't done real good research on something quite yet,
Well,
for
sure,
one
but that
herb or one
2,000-year
supplement.
track record, that's
Exactly.
evidence.
Exactly. So, how do we get more people to understand that? I mean, I think we are, and we're looking for that,
Yeah,
but I still think it's not quite there yet.
I agree with you. It's not quite there yet. That's okay. It's getting there.
Right.
Chinese in China, the Chinese system is much more integrated than ours. That's my understanding. I haven't studied over there for a variety of reasons, but my colleagues who have, and from what I've read about, their medical system is much more integrated. Where you go there are Chinese medicine hospitals, and then there are Western medicine hospitals. But my understanding is for a lot of people, if you have knee pain, you start with acupuncture and Chinese herbs and Tai Chi and physical therapy, kind of like how we have physical therapy here before you can get an MRI and eventually work your way up to, cortisone shots and a knee replacement. Um, but over there, the Chinese herbs and acupuncture and some of those traditional tools are part of the first line, physical interventions that they do. Um, and, because of exactly what you're talking about, more and more people are asking for the kind of things that I provide and people like me provide. So I think it's moving in that direction. I mentioned the VA earlier. The VA sends us referrals for acupuncture, and they do acupuncture for veterans because veterans ask for it, because it works for them. And people found out that, hey, acupuncture helps with PTSD, and a lot of veterans have PTSD. A lot of veterans, from the Vietnam War era have conditions tied to Agent Orange exposure, cancers and metabolic problems. And, there are veterans of the Gulf Wars who have, Gulf War syndrome and all kinds of stuff. And a lot of chronic illnesses they're difficult to manage and difficult to deal with. So acupuncture and holistic approaches can be really helpful, um, for all the reasons that we've talked about. Yeah.
How would you tell people to look into it or to find that other side of it, the holistic side? Because again, I feel like people just don't know. And
I agree
it's
with you.
a huge tool that they're missing out on.
Yeah. Yeah. 100%. And as for people like us who have been in it a little bit, it's easy to forget that what not everybody else knows. But yeah, if there's a ton of information on social media and online, more and more. I don't spend a ton of time on social media, but probably because of my interests, like when I go on Instagram or something like that, I get lots of reels from people about lots of different natural health tips and things like that. For acupuncture and Chinese medicine specifically, there are some books that are pretty good. There are introductory books. There's a classic is called The Web That Has No Weaver by Ted Kapchuk. Um, I don't know how many people have time to sit down and read books these days, but um, that's a pretty good one. It kind of goes into, a lot of people start with that one in acupuncture school. There's a really practical book that I like called Acupressure's Potent Points. Michael Gach is the author, I think, Gach. That one's just a really practical, like a manual with protocols for different conditions. Like, oh, I got a headache, and you look it up, and it's got pictures, and okay, if I press on these points, and it's going to help my headache feel better. And that's where I started. I got that book, and I found it, and it was helpful for me. And that gave me some like, hey, this stuff really works. I don't know if there's a book like that for Chinese herbs. That's a little bit more complicated. Um, there are acupuncturists and Chinese herbalists all over the place now. We're almost as common as chiropractors. So a good place to start is, search for acupuncture near me on like Google, and you go, there'll be a bunch of places close to you, and you can call around and ask places, and a lot of insurance companies nowadays will cover some acupuncture. I would say maybe it's 50%. I don't really know, honestly, because I'm probably biased because it's 50% of the people who call us
Right.
ish, but that's not necessarily indicative. A lot of senior, like Medicare supplemental plans, cover acupuncture. Medicare kind of covers acupuncture if it's done by a doctor or a nurse. So, which I won't get into. It's a funny political thing that we haven't figured out as a profession yet. But many of the supplemental plans will pay us to do it. And so lots of times I have patients who come in to see me because they have knee pain or neck pain or headaches or something. And I always, I start with acupuncture and talk to them and lifestyle change and stuff. And then if they need herbal medicine, we introduce that. And then there are other conditions like ulcerative colitis. I've had good luck treating that with Chinese herbs. And, that there aren't a lot of drug options, pharmaceutical options for that condition. I do see a lot of patients going through chemotherapy and oncological care, and uh, acupuncture and Chinese herbs can be quite helpful for some of the side effects, the nausea and fatigue. And um,
So when would you say, and this will be the last question, but when do you seek out a doctor like yourself?
I mean, I think anybody could come to see somebody like me. A lot of people wait until they've tried everything, basically. I hear that a lot. And where the term that we use is provider of last resort. And a lot of providers are like that, in the functional medicine doctors and acupuncture chiropractors, right? And I oftentimes people really have tried everything, but I think that you don't have to try everything to do acupuncture. I think a lot of people they get scared when they hear about needles, and they're like, why would I want to get needles? Well, they're tiny pins, and most of the time you don't feel them at all, or maybe you barely feel them. The experience is basically you come to the office, we have a chat about what's going on with you, and then you get to lay down on a comfortable table and take a nap with the lights off. Usually we use a little heat lamp, it's nice and warm and cozy, and um, people almost always feel much better. And honestly, the people who come sooner usually get better faster. The longer a problem has gone on, the more entrenched it becomes, and the more difficult it becomes to shift things. So, younger patients, people who have had it's an acute problem or something that hasn't been going on for so too long, though those patients see changes a lot faster generally. And so you don't have to have a serious health condition to get acupuncture either. If it's stress and you're like, man, I'm not happy, I just don't feel happy, and I'm stressed out all the time, and I got a short fuse, and I'm yelling at my kid all the time, you know acupuncture would probably help, honestly.
I mean, honestly, it could be used as a proactive tool. Just your overall health and wellness.
Yeah.
It could
Yeah.
be a weekly thing, a monthly thing, whatever you look at it, but there's no downside really to it.
No, not really. I mean, it's apart from cost, of course. And what I usually tell people is, um, just like how your car needs maintenance. Your car needs oil changes. It needs new brake pads from time to time. Our bodies need maintenance too. And most people benefit from some sort of regular physical intervention, body work, massage, chiropractic, acupuncture, PT, Tai Chi, yoga, something like that. even if you're working out all the time, you're probably going to benefit from getting something like acupuncture or massage or chiropractic or PT regularly, because it helps keep things, we need help from other people. And we're it's easy for us to just get our blinders on and not realize that some problem is going on. So, I just think of it as like getting an oil change in your car. And, a lot of times, a lot of people's insurance have 12 visits a year. Well, that's because once a month is kind of like a pretty good general cadence for getting a regular maintenance treatment. And that's a lot of our patients do that, especially if they have, it's not all insurance, but especially if they have insurance, and, it's a benefit. So that's one of the good things about insurance, right?
Right.
Like
Well,
you're paying for it. You might as well use it.
exactly. Well, and again, your health is important.
Yeah. The most important thing, right?
How much money? I mean, it shouldn't even be about the money. It's just, yeah,
Yeah.
I don't know.
Yeah. No, I agree with you.
Sometimes I think, again, I waited too long. I know I did. I'm trying to do the right thing now, but I definitely waited too. I was that stubborn guy in the corner that I can
I
get
get
through
it, man.
anything.
The thing is like if you've been healthy, it's tough, especially if you've been generally healthy your whole life, because when a problem comes up, you just thinking, you keep thinking like, this is gonna go away. I'm gonna get better. I don't need help. You know what? Everyone else in my life needs my help. I don't have time for this. I get
That's
that.
exactly, yeah.
I get that.
That's
Yeah,
exactly how, well, and then I was going through it with my wife fighting her cancer. So I sat there going, I don't have time to be sick,
100%.
And I
Yeah,
look back going, I don't even remember the last 2 years because there was always stuff we are having to take care of the kids it was just never ending. And then finally it's got to the point where, oh, I better take care of myself here. Well, pretty much after my last surgery, it's
yeah,
like,
yeah.
oh, yeah, this isn't going away anytime soon. So, yeah, be proactive.
And one of the mindset shifts that you can make, you mentioned your kids and your family. I mean, we're no good to if we put off taking care of ourselves to the point where we fall apart, then we can't help all the other people in our lives. So if you can psychologically, that motivation can help you to get over, a lot of us have hangups around we don't deserve to take care of ourselves, or, I don't need help because, I got to be strong for other people and stuff like that. And I think that that's going back to our earlier in our conversation, that's a big thing that I think needs to shift in our culture for things to change and get better in our culture and our country. People need to start helping each other and networking and talking and helping each other to be healthy and get over things. So, and you
I
get that.
Yeah, I have a video coming out. It'll be different with when this is released, but I basically said be selfish.
Yeah.
That is the time to be selfish, is to take care of yourself, because that is a positive for everybody. If you
Yeah.
don't, it's a negative. And trust me, I know
Right.
us going through our cancer was a negative for all our family and all our kids. So if you're selfish in a proactive way, everybody can benefit.
Yeah. 100%. It's a little bit like you're almost like doing judo or aikido with yourself, with your brain. You got to sort of like think like, okay, I know I need to do this, but I don't really want to. How can I think about it in a way that makes me want to do it? Because you got to get that your hope pulling you forward. You want your fear pushing you towards your goal too, and not pulling back the other way. But yeah, anyway.
Well, and I had somebody say to me, culture, you turn a certain age, it's like, oh, you're this age, so that's an excuse not to do anything
Right.
anymore.
Oh yeah.
I'm 50 years old, but I got a 6-year-old at home. I can't have that mentality. In my
Yeah.
mind, I can't, but there's so many people that do. And they're not out there playing soccer with their kids, or they can't.
Yeah.
They,
Yeah.
oh, I'm 50, I'm done.
Yeah.
Oh,
Yeah.
you got potentially a long time to go.
Yeah. Yeah. Absolutely. Yeah. I'm a little younger than you. I'm 44 this year, but I have a 5-year old and two younger than that. And, it motivates me to get in the gym and lift and eat right and take care of myself. And it's funny because I have buddies who I've been friends with for, since we were kids, and I get on them about exercising, and they're like, "Oh, I don't have time. I'm too busy with the kids." And I said, "No, man, you're using it backwards. You're using those kids as an excuse to not exercise. You got to use that as motivation to get out there when you don't feel like it."
Yeah, I agree 100%. And again, that goes for all the alternative medicines. I don't even like saying medicine because it's not just medicine, it's alternative, it's holistic way of looking at everything. I do Tai Chi. I love it. And that's that side that you get the stretching, you get the mental part of it, you get the breathing, you get to slow down. Those are all things we need in our everyday life. I don't
Yeah.
know.
Yeah, I
That's
agree
just
with you.
my take anyway.
100%. You're preaching to the choir.
Right?
I'm right
We
there
just
with you.
we're preaching to everybody out there. Hopefully I know they don't like being told what to do, but
Well, I think if
coming
they're,
from people that have been there, it's just, God
if they're
dang.
watching the show, I think that I'm sure people will be on a similar wavelength.
I hope so. Because
Yeah.
that's what we're here to do, is just help.
Yeah.
Dr. James Lewinsky, it was an absolute pleasure.
Oh, likewise, Jonathan. Thanks for having me on the show. Hope we can do it again sometime.
Oh, we definitely can. No, I really appreciate it. All right, everybody. That's all I got for today. As you guys know, find the attitude, keep the attitude, go out living.